My name's Nella. I'm 60 years old. This is my daughter Natasha. Italian family, husband's Greek, very loud. Did like our food, so a lot of Italian food. We weren't big drinkers. My husband doesn't drink, but if you go out, like to have a bit of a drink. I was 57 when I was diagnosed. Very active person. Go to the gym 5 times a week, lift weights, a bit of boxing. I had Arnie arms, I used to say.
Hi, I'm Jan, 68. I was diagnosed in 2023. Food is the center of everything, so we have a very good social life, and we always have parties. We invite a lot of people back to the house to have dinner parties, so it's always been a feature of our life.
I'm Steve, this is my wife Yvette and Kara, and the rock I lean on through this cancer journey that we've been on for the last 10 months. 9 grandchildren, ranging from 2 to 17 years old. Yeah, we retired at 4 years ago. We're tram drivers with Yarra Trams, both Yvette and myself.
My name's Jess, I'm a dietitian. I work at Peter Mac. I work specifically in upper GI oncology, so that's people who have cancers of the stomach and the esophagus, and so our job is to help people with their nutrition during their cancer journey.
While I was having treatment, like the chemo and the radiation, especially the radiotherapy, towards the end, I pretty much couldn't even swallow. So it was really painful. I didn't feel I was getting the nutrition. I lost a lot of weight.
Came as a shock to me because I've never had any serious illness before. The advice from the dietitian is that I must have lots of protein built up, the strength to withstand the recovery after the surgery.
The day before I started chemo, they took the feeding tube out, which was an absolute godsend, until I started chemo, and then I really struggled to eat anything, and I didn't have the feeding tube as a backup. And yeah, I lost 10 kilos. I'd say keep that feeding tube in for as long as you can. I would have, except that it became infected in the end, and a good idea to take it out, yeah.
Before the operation, everything was protein. So I was trying to get all the protein in, and then after it's like fats to try and build up.
So it was a 9-hour surgery. They removed the tumor and part of the esophagus, and I started recovery with a smaller stomach, so I couldn't eat much. So I had to relearn how to eat, not so much as the type of food, but the quantity.
Having the surgery, obviously, you can't eat a lot straight afterwards, but you've got the feeding tube. That's a bit of a lifesaver because you don't need a lot of food that you eat, you are chewing up. You can just top it up with that sort of thing.
If we're talking about the immediate post-op surgery period, a lot of our patients have to go through a graded diet upgrade. So that might be liquids to begin with for a little bit, then puree, then soft food, then eventually get to solid food. And the reasons for that is that the join that they make when they do the surgery between the stomach that they pull up and the remaining little bit of esophagus, that's a really delicate join. And so eating really tough, hard, crunchy foods can risk that joint.
That's why I got a really nice blender that can cook as well. So I just put all the protein like fish or beans, vegetable into the blender and then press. So it will come up like a thick soup.
So I would try and, like, what they were eating, I would puree it. Sometimes it worked out okay. Sometimes no, not a good idea.
I swear I bought a different protein shake every week. Well, try this protein shake, try that one.
And we did.
Can we add this? Can we put sustagen in there? Can we, because we ended up with a lot of smoothies. Smoothies kind of.
Smoothies, chicken soup and fruit.
But it is a huge milestone when you get to that end of the 4 or 5 weeks where you've been on a texture modified diet and you can start to have solid food again.
At the 4-week mark, the dietitian said, listen, you can go easy, but you can try anything you want. Just make sure that it's cut up small.
So he went home and bought a pizza.
So as soon as they gave me that news, I just brought a pizza, and I only could eat one slice.
The only worry I had after the surgery was that I couldn't take certain kind of food. But fortunately, when I spoke to the surgeon, and the first thing I asked is, can I take spicy food? He looked at me and said, you can take whatever you want, curry, yep. So I'm very happy that, I was able to enjoy, the sort of spicy food that I grew up with. There's a saying, you can take me out from Malaysia, but you cannot take the Malaysian out of me, because in Malaysia we grew up, from young age, 3, 4, having spicy food.
Quality of life is something that we are really big on, and we want to make sure that when people are going through treatment that we try to preserve their quality of life as much as possible. So if you have a symptom or you're struggling with something that's really affecting your quality of life, that means it's important enough to tell somebody about it.
Fatigue is probably one of the big things. Definitely get tired. Still, even now, I get very tired. I have a lot of early nights these days.
The quantity is always the issue. You look at it, you like the food, and then you say, maybe I'll just have a little bit more. And that little bit more, sometimes you crosses the line of being okay to not being okay. Yeah.
Because I can only have small portions, sometimes I'm hungry and I overeat.
But even after dinner, if she says, I'm so full, I feel sick, and then 2 minutes later she'll go and get an ice cream. I'm like, you just said you feel sick.
Hungry.
Why are you doing that? But she still wants to enjoy her food. So, yeah.
It is really different for everybody, and what might be applicable for one person might not be applicable for another person. And so the role of us as dietitians in supporting people through that post-op period is to understand, okay, what's going to work, what's not going to work, because everybody has a really different experience.
As a carer, sometimes you forget that you need to eat, So in the end, I'd have to make myself a small stir fry or a small, when he wasn't eating wasn't allowed to eat anything.
We try to set expectations around not coming back to baseline, but it's about adjusting to a new normal.
The limitation is the quantity. And if I go beyond that point, I know I'll suffer. And I don't like that feeling, wake up in the middle of the night with this very bitter taste in the mouth. Because it's like a burning sensation. It comes out through your throat, into the mouth.
It's like a heartburn. Yeah.
I would have panic attacks in the beginning, eating out after the operation with people, because, is that all you're eating or whatever? And I'd be self-conscious, and I feel like, I can't breathe.
I often say to patients, you don't know anyone an explanation. So I think, if you are going to go for the smaller meal, or you're just going to have an entree size, or you're just going to choose a pastry off the shelf rather than having a big breakfast, that's okay, because that's what, you've been through a huge amount, and if that's what you can manage, then that's what you can manage.
The only other thing with eating is I found I have to eat earlier because I can't lie back. You've lost your sphincter muscle there. So everything can come up.
There's a feeling that, it's full, it's stuck. It takes a long time for that feeling to go away.
And reflux.
And especially in the evening, if I have too much, when I go to sleep.
He lost a lot of weight. I'm probably a hyper-focuser, so I'm like, okay, so the dietitian said you should eat this, this, this and this, and so I was a bit naggy, and he was a bit, what's the word?
Annoyed?
Yeah, got a lot of pushback.
I mean, Yvette did the best she could to persuade me, and so did the dietitians. You can only have so many cold smoothies.
Food is one of the few things that we can control in the lead up and in the recovery from surgery, and I think everybody knows what they should be doing, and sometimes patients are trying really hard and carers are trying really hard, and sometimes there can be a bit of friction that comes as a result of that.
Everybody's journey is a little bit different, so what worked for me might not work for somebody else, but at the moment, as it stands at the moment, I can eat anything I want, just in probably not the large amounts that maybe I did before.
And for a lot of people, just because you're on a solid diet doesn't mean that you're back to eating normally. So it is kind of a long process. So you go through all those stages of diet upgrade, you get to the solid food, but it still might be a number of months before you have any kind of resemblance of what might have been a usual meal for you.
The interaction with the medical team. Good team, I follow what they say. Whatever they ask me to do, I'll do.
Yeah,
I
that's
think
what we did.
that is
Yeah.
the foundation, you know, for the recovery, because you got to trust the team, and then I am very grateful, you know.
You're both stressed, and you. It's a lot of pressure, and there are going to be times where you're going to argue, and you know we're not big arguers, but there'll be times where things will get heated.
Yeah.
But you just have to get through that and try and listen to each other and what each other's saying, because you're both coming from different areas of stress.
And I think the only advice is, you know, be in the right frame of mind. Always look forward to the next day. You know, you wake up, nice, good. You know, let's see what I need to do today.
Feel your feels, like if you feel like, oh, why is this happening to me today, or I feel sick, that's okay. You're allowed to be like that, and then just pick yourself up. Okay, that's fine. Tomorrow's another day, let's go.
My advice is to follow the professional's advice and do everything you're told, and with a bit of luck, you come out the other side and you'll be okay again.